My name is Dr. Allison Tarlow. I'm a licensed clinical psychologist in the state of Florida, and I am the clinical director of Boca Recovery Center. At Boca Recovery Center, we have a medication-assisted treatment program that was developed by Betty Ford Hazelden in Minnesota, and it is called the Core 12 program. Core 12 stands for Comprehensive Opioid Response. It involves the medication-assisted treatment together with the 12 steps and really combines the two approaches so that the patients are receiving not just the benefits of the medication, but also the support and the programming of a 12-step process. The Core 12 program that was developed by Betty Ford Hazelden is different because it is an evidence-based approach, which means it was based on research and development out of Betty Ford Hazelden, and it really combines not just the use of medication, but also different evidence-based psychotherapies that have been proven to work with the population of individuals who struggle with substance use disorders. What's really important is that people could participate not just in getting the medication, but they have to participate in the therapeutic part of the program, and that's really where the benefit would lie. Core 12 involves 3 different possible pathways. The first pathway is what we call the no medication pathway, which means that no anti-craving medications are being used. The second pathway is the naltrexone pathway, and that's really an anti-craving medicine that's very good for alcohol use disorder and also for opioid use disorder. The third pathway, which is usually the most commonly thought of when one thinks of medication-assisted treatment, is the Suboxone pathway. And what that involves is every day the client is brought to us and we give them a dose of medication first thing in the morning. That really helps to block the receptors that would be triggered by an opioid. So the patients will come to us and not only receive their medication, but they are expected to participate in full clinical day, including going to psychotherapy groups and going to individual therapy sessions. And then in the evenings, they are brought to 12-step meetings, and they are expected to participate in those 12-step meetings. So what that means is they would find a sponsor and start working on their steps. And that really provides them with a very strong support network so that when they go home or whether they stay in the area and complete treatment with us, they really have a strong, firm footing in their recovery. And those are the 3 different pathways that medication-assisted treatment would follow and in the Core 12 program. When individuals come in to Boca Recovery Center and if they are deemed eligible for our medication-assisted treatment program, what we like to let everybody know is it really is not a one-size-fits-all. And what I mean by that is everybody is different and may require a different milligram or dosage. Generally, the other thing that we try to take a look at is how long somebody's going to stay on the program. It's really an individual choice, and treatment team recommendations will always be made. But for some people, being on medication-assisted treatment will be a lifelong situation in order to allow them to be a productive member of society. One of the things that we do is we have our case managers set up with local providers in the area to which that the client is returning, and we set them up with an appointment so that they can continue on medication-assisted treatment with that physician back in their home area, along with our treatment recommendations, so that that is something that they can continue to do. And most places around the United States now do have physicians and providers who are familiar with and comfortable with medication-assisted treatment programming.